focusing on that, and this is why we this is another effort by the Black church. You understand? So when people tell them that we don't care about our community, get out of here. We were out there, out in the midst, making sure that people had the correct information, and they knew exactly, and we took our church bands, pastors, and you know you did too, made sure that we drove folks to make sure that they got that vaccine, okay?
We have people here on site. We had vaccine clinics here at the church.
That's right. That's right.
Remember, people come to the church to be vaccinated.
That's right. That's right. That's right. So we put our own lives on the line, as the scripture, and that's why God blessed us and continue to bless us. So we're going to continue to do it. So we got 2 down, 23 more cities to go. So we're doing good. We're doing good.
Excellent. Kind of out of sight, out of mind now. You know,
Right.
not hearing. I mean, right. People are not really saying much about it.
Yeah.
This is kind of invisible now.
Well, that's what we.
And it's silent.
Yeah.
The media has become more silent, right? And so we see this. Y'all remember when the mosquitoes and the pregnant women, remember?
Yeah.
And I would still every day had to talk to pregnant women about the mosquitoes and traveling and things like that, but it wasn't on the news anymore.
Right.
So it didn't become top of mind. Same thing with COVID, right? We're seeing, you heard me say, 600 deaths a week.
Yeah.
That's right.
Right? We're still
Never
we're
heard
still
that.
hospitalizing.
Oh yeah, they haven't.
Right, but it's not on the news anymore.
Right.
You're right. I'm talking about, yeah. So
Right.
it's not on the news anymore. But you know, this 6% increase we've seen in the last, in this last month, right? It's just that it's not on the news. Oh, people, you're right. It's out of sight, out of mind.
Right.
But I think as black people, we can't lead with that. We got to always know, because many times we got other medical conditions that put us at higher risk.
Exactly.
Right.
Absolutely.
Exactly.
So we're gonna do a shift.
Thank you.
Y'all please go to the fellowship hall and do it. And y'all can conversate more over there.
been trying to
But
get
my
with
committee
Tiffany.
went through a lot of trouble to prepare that for you all.
because
So
you
please,
are-
let's make our way.
We
over
need
to
some
that.
time together. We need some time
I
together.
think I met you with Tiffany, right?
Which Tiffany? Tiffany.
Young.
Oh.
Were you in DC at CBC or something?
I was
we met, it was
there.
last year. I know we've met
But
before.
I said, because we have all these presidents in the Metroplex that are females, between yourself,
You know, so-
AKs, Deltas.
Were you in Austin last night for CBC?
No, I
The
wasn't.
Texas CBC, and Freddie Haynes was keynote, but they brought that up. The president of Delta, president of AKA, you got me, all these presidents.
There are at least 5. There are at least
Yeah.
5. But you know, you say there's an issue. People have forgotten.
They forgot.
Should we be telling folks to wear masks?
I wear masks quite a lot. I don't go to a grocery store without a mask. I have not flown an airplane without a mask. I've not been in an airport without a mask yet.
That's right.
If I come to church, I wear a mask.
Right.
So but I also think it also depends on who you are.
Right.
When you have you got asthma, you probably do. It's about the only thing you could do, because you just can't testify to who's around you that's been vaccinated.
Right. Okay, well, I talked with, the CDC was here a few weeks ago, but I was out of town. But I did mention to them that I had contacted Commissioner Price about fentanyl, and he put me in touch with Dr. Wong and at Dallas County Health and Human Services, and they did not see it. I didn't get any follow-up from them anymore, and Commissioner Price and I talked about that, but now it's an epidemic for us here. And recently I just wrote about how we, poo-pooed AIDS because we said it was, white men, and we would not, and we see what happened when people do not have condoms, because not only did you have the births, but you had the outbreak. Well, the same thing with the mask. You have people fighting wearing masks, fighting getting the vaccine. What do you say to that person who doesn't have a good reason why they won't get the vaccine? They say, I just don't want to. I don't trust the government.
So what I learned early on with this, because it got so politicized, I educate. I'm not here to argue with somebody, because I respect you grown, right? I've had parents who have children who need the vaccine, and they won't even vaccinate their children, right? And some of this isn't new with COVID. I'm an OBGYN. We tend to give a lot of vaccines. We deliver babies. Babies always got to have vaccines. It's been simmering in this country a long time. It's just it came to the surface, right, when the pandemic hit. And I don't think some of our public health colleagues, some of the health departments were doing enough early on before the pandemic. And then when the pandemic hit, it was like, oh, people don't trust it. People don't trust vaccines, right? And so I continue to educate. I'm still moving. I keep on moving forward because I know I may not conquer everybody. I'm not going to win. But that's not my role, right? I'm not trying to overrule, but I do believe education is that's how I preface it with every patient, one-on-one and individually.
Well, I'm glad to see that the church, because I think it was just recently I heard we were at Paul Quinn College, and they were talking about how a lot of things that should be happening should be coming from the church. And so to see the church, to see pastors stepping up and saying, we're going to take this, because you can't wait for anyone else to save our communities.
No.
Right. And that's why I'm all about educating our people. Like I said, everyone is mature that does that, make their own decisions, but I think you need all the information to make your decision. And have some scientific facts along with that decision-making process, instead of just someone, because whether it's, and no one in particular, whether it's a friend, a relative, a famous person, but you say, well, they said. But what are the scientific facts? What are we making a decision on? And again, that's why I say I think we need all of the facts to make an intelligent decision.
And that was the single motivation of creating Vax News, to make sure our people have the facts.
Thank you so much.